Appreciate you guys coming. Appreciate all the staff that is able to take their time to come out this afternoon as well. We will have some opening addresses first and foremost, and then we will open up to question and answer. I want to introduce our chairman of the board, Joseph Matthews. Do you want a mic?
Good afternoon. Thank you for being here. The South County Health Board of Trustees thanks our volunteers, our medical providers, our staff for their service to our communities. Their dedication to delivering care is why we lead the state with CMS 5-star quality ratings, Press Ganey's Pinnacle of Award for patient satisfaction, and Leapfrog Grade A for patient safety. Thank you. In these challenging times, the Board of Trustees remains mission-driven. We strive to be your most trusted health partner. With board agreement and oversight, the management team is working a plan to maintain our quality standards and to do so in an accessible and financially sustainable fashion. But in retrospect, we can push too hard. We can demand too much. We become focused on the process outcomes more than explaining why to the community. That's the board's responsibility. We can do better, and we will do better. Last night, the Board of Trustees gave its unanimous vote of confidence to Aaron Robinson, our CEO, and the executive leadership team. At the same time, the board authorized resources for the executive leadership team to ensure that all who provide and receive services here at South County Health are treated respectfully, feel that they are heard, and that they are appreciated. Going forward, the board commits to greater engagement using interactive public forums, soliciting patient participation in the design of the service line deliveries that they use, and renewing past relationships. For those who harbor concerns, we are here. Thank you for your support. I will now introduce Deb Randall, South County Health's Vice President of Quality, who facilitated a recent federal investigation of the quality of our systems. Deb?
Thank you. Good afternoon, and thank you for joining us, members of the media. As Joe told you, I am Deb Randall. I am a nurse with over 40 years of experience, more than 20 of which has been spent at this organization. I have spent years at the bedside, as well as in administrative roles that have led me to where I am today in my current role of Vice President of Quality. I think it's important to note that I also was one of the bounce backs. I left for a period of time, about 8 years, and then I returned again after Mr. Robinson joined South County Health. So I've been here now another 5 years under his leadership. I'm also a 50-year community member of South County. I have come here for my own care. My family has come here for their care. This is where they trust to come. and it's where I trust to come as well. I believe in this hospital, and I believe in the entire organization, and I know exactly what our priority is, and that is to ensure the delivery of safe, quality patient care. I know that I speak for many, including those of you who are gathered in this room, many of you, all of you, that our patients are our top priority. And they are the reason that we come to work every single day. They are the reason that I am passionate about what I do, which is the oversight for patient quality and safety at South County Health. It is personally and professionally upsetting to me. It's hurtful to me when I hear all of the misinformation that is outside of this hospital and in the public. Because I know that it in no way is an accurate picture of what is happening inside these walls. The only thing that it has served to do is to create unfounded fear and anxiety in our patients, and they do not deserve that. We at South County Hospital certainly don't want that for them. Beginning on Tuesday, September 10th, and concluding on Wednesday, September 11th of this week, a federal CMS investigation was conducted at South County Hospital in response to the open letter that was shared with the public and the media. The investigation was conducted by 2 Department of Health investigators and a representative from CMS. They focused on organizational governance as it related to this misinformation, this inaccurate information that is in the media and being shared in the public. Simply put, the investigators, were here to ensure the public's welfare and safety when they came to the hospital. Their main concern, their focus, was on our cancer and infusion center. Their impression, which was based on this misinformation that has been introduced to the public, was that there was a mass exodus of 20 to 40 physicians from our cancer center, and that our patients were left with no one to care for them. In fact, they learned that 3 out of 4 physicians chose to no longer practice here in oncology. They found that these 3 physicians are still at South County Hospital today and are still caring actively for patients in our cancer center, and they will be here until mid-October. They also learned that we are bringing on 3 physicians to replace them, and that there will be a period during which the ongoing and outgoing physicians will overlap, allowing for a smooth transition of patient care with no gaps whatsoever. The investigation was facilitated by myself and our Director of Quality, Sandra Kolpitz. The investigators thoroughly reviewed organizational structure, medical leadership, service line scope, and letters sent to our patients. They interviewed members of our executive leadership team, including our Chief Medical Officer, Dr. Kevin Charpentier, our Chief Nursing Officer and Chief Operating Officer, Dr. Anitra Gallimore, our Medical Director of Oncology Services, Dr. Angela Tabor, and our President and CEO, Aaron Robinson. In addition to oncology, the other service lines that they investigated were cardiology, pulmonology, and nephrology. Following these review sessions and interviews, they also toured the facility. Key areas that they viewed were the oncology practice, the infusion center, and the cardiology suite, and they had the opportunity to view our patient cardiac rehab gym. The investigators had a chance to interact with staff and leadership while observing day-to-day operations. They saw firsthand what was happening within this organization, and that's that operations were alive and well, thriving, patients were being well cared for, that there was no gap in any of services that we were providing. We then concluded the tour and moved to closing. I am proud to report that this federal CMS investigation resulted in a deficiency-free survey. There were no deficiencies. The team had no concerns. All of the services were confirmed to be operational, and there are no current or anticipated gaps that were identified in patient care, service, quality, or safety. We welcomed this survey, and we are grateful for the validation of the exceptional care that has been and will continue, as always, to be provided at South County Health. So I want to thank you for coming today and listening to this. At this time, I am pleased to introduce and welcome to the podium our Chief Nursing Officer and Chief Operating Officer, Dr. Anitra Gallmore.
Thank you, Deb. Good afternoon, everyone, and welcome. I'm Anitra Gallmore. I have the honor and the pleasure of serving as the system's Chief Nursing Officer and Chief Operating Officer for the past 4.5 years. I take this role very seriously. My responsibility and accountability for patient outcomes and the work environment for all of our team. Thank you for the opportunity for truth and transparency regarding the care and services that we provide at South County Health. The findings from the Rhode Island Department of Health and Center for Medicare and Medicaid Services investigation confirm our organization's commitment to exceptional patient care and service. This was a deficiency-free investigation, meaning there were no findings to support the misrepresentations that continue to unfortunately circulate in this community. South County Hospital remains a Medicare 5-star hospital, a Leapfrog Grade A for quality and safety, and we were recently recognized as a Press Ganey Pinnacle of Excellence awardee for leading the nation in patient experience. Let me be clear, we are a leader in quality and safe care in the Rhode Island market and have been for many years. In fact, in the most recent performance period, Medicare scored South County Hospital's overall quality, safety, and patient experience 61% higher than Rhode Island's average and 105% higher than the national average. These are the facts. Surveyors had a chance, as Deb stated, to interact with our incredible staff and leadership throughout the organization, and as they observed the day-to-day observations, they stated, you don't have a clinical quality issue, you have a perception issue. The survey team had no concerns. They were impressed with our modern environment of care and our patient-centric designs in the clinical spaces that they toured. All services, as Deb stated, were confirmed to be operational, no current or anticipated gaps in any areas of service or quality across the organization. As a Chief Nursing Officer and the Chief Operating Officer, I'm always a nurse first. I'm deeply saddened that our staff and our providers have been subjected to unwarranted accusations that they perform anything but high quality care. And at the core of all of this is our patients, who continue to be subjected to misrepresentations that are creating avoidable suffering by the insinuation that the South County Health System is somehow a failing system, inaccurate. During patients' most vulnerable time, when they need us the most, these misrepresentations create worry and seek to distract us from our mission. We empathize with patients impacted by changes, and as stated by the surveyors, we are responding in a meaningful way to ensure uninterrupted care and service across the health system. The misinformation provided by Drs. O'Leary and Farah have created frustration, disappointment, and anger for our staff as their very dedication and service are being inaccurately portrayed. This is doing a disservice to the community. Again, we welcome this investigation. We thank you for the opportunity to share our truth. We are grateful for the validation of the exceptional care that South County Health continues to provide each and every day. At this time, I'm going to open up the podium for our Chief Medical Officer, Dr. Kevin Charpentier.
Good afternoon, and once again, thank you for being here. As Anitra said, my name is Kevin Charpentier. I am the Chief Medical Officer for South County Health. I joined the team here a little bit over 2 years ago. By way of background, I'm a surgeon, and I've spent the majority of my career caring for people with some of the most difficult to treat cancers, pancreatic cancer and liver cancer. I'm going to address the upcoming physician transition for a number of our patients in the Cancer Center. As not only system administrators, but also as fellow human beings and community members, we, the hospital, the leadership team, and the executive leadership team, are keenly aware of the stress, fear, and anxiety that the loss of a trusted physician can cause for a patient or a family. To that end, the executive leadership team and the senior leadership team at South County Health has worked tirelessly in efforts to make the upcoming transition for our oncology patients from one physician to another as smooth as reasonably possible. It has been stated in the news that the entirety of the oncology physicians have resigned. That is factually incorrect. Dr. Christopher Seidler has been on a leave of absence. However, we anticipate him returning in mid-October to serve as the interim medical director of oncology. In addition, South County Health has contracted with 3 oncology physicians, Dr. Lee, Dr. McKinney, and Dr. Alarcon, all of whom will be joining South County Health in the first 2 weeks of October. As Deb stated earlier in her comments, there will be an overlap with our new oncology physician start before the departure of the physicians who have resigned, leaving no gaps in care, and we will make every effort once again to try to make the transition as smooth as reasonably possible for our patients. Thank you.
We're going to open this up to you guys stand right in front of the backdrop. Joe, Aaron, Deb, Anitra, and Kevin.
Hi, Pat Ford, Coalition Radio Network out of Providence. It's been alleged, and it's important that we say the term alleged, that board meetings are held in private. There isn't a public component to board meetings. Obviously, there's always a call for executive session, but is that true, and is that something you plan on addressing?
All of our board meetings are held in private. The conversations are confidential, and the discussions are confidential, so that we can have a free exchange of ideas and thoughts. There's no plan to make board meetings public. That having been said, the board recognizes that we have to be more engaged with the public, more available, and to interact based on the experiences that we're seeing concerning the misrepresentation of the events.
Mr. Chairman, in your opening remarks, you mentioned something about, and forgive me, this is not going to be an exact quote, but you mentioned something about allocating resources to increase things like respect and being listened to. What exactly do you mean when you say resources there?
What the board is acknowledging is what we consider mistruths and misrepresentations about the culture and the approach of the leadership team. And one of the things we want to do is ensure that working with the leadership team, we are able to evaluate and maintain and address as things come forward any of these issues.
I would probably direct this at the Chief Medical Officer. Perhaps obviously, without getting into personal situations, what was the stimulus or the cause for what is alleged to have been a rapid turnover of high-level surgical and medical staff?
Yeah, well, I would say first, again, I'm going to say that that's misinformation. That there has not been a high-level turnover of staff here. What you have not heard publicly is that our medical staff has grown 35% since 2000. Our medical staff was made up of 399 physicians and advanced practice providers in 2000, and we have grown to 539 as of now. If we look in our employed medical group, or let me say first, if you look at, what is the expected turnover for physicians and advanced practice providers in the United States in general. There's different numbers, of course, depending on which source you look at, but the numbers that we see range from about 7% per year up to 11% per year, and our turnover is 8.9% per year in that same time period. So the supposition that there's been a mass turnover is just factually incorrect.
And if I could address this to Mr. Chairman, by all accounts, it would appear that your hospital, South County Health, remains the only independent hospital left in Rhode Island that's not part of some major chain. Is that, in your opinion, is that sustainable? Is it desirable? Is it something that you're looking to address as an organization? What are your thoughts?
It is not sustainable to remain independent. Ultimately, we will have to find a partner to work with for the benefit of the community to maintain and expand the services in an ever-changing demographic.
Thank you.
What internal work, obviously financial strain is what's going to inevitably be that sustainability part, right? And we've talked about low reimbursement rates. What's going on behind the scenes to ensure right now in the interim that you guys are providing that continuity of care?
You might have to answer this one.
You go first and let me know.
It turns out that as I have met with patients at the cancer center, the last thing they want to talk about is finances. And I think that's what makes us unique here, is that we care about our neighbors. We are going to find a way. We have an incredibly talented executive leadership team where we are trying to push where we can, innovate where we can, explore different ways of delivering the same quality health care in a different way. And that can be stressful. But I'll tell you, we have 120 days of cash on hand. And that's not so bad when we look at our peers in this state. But the key is we have to make intelligent, strategic decisions now so we don't have these issues 4 or 5 years from now.
Much has been spoken about, obviously, cancer care and cardiac care. For either of you, perhaps Mr. Robinson, how would you describe the current status of, I'll call it more community health care? For example, emergency room care, gynecological services, birth and maternity services. Where does that all stand in the mix right now?
Yeah, thank you for that. I would say that, as Joe mentioned, we are looking at all of our service lines. One of our core strategic initiatives is to build service lines that serve the demographics of the community that we serve on an ongoing basis. And we continue to look for ways to grow women's services, for instance, OB. We've done that year over year. And then we are looking at, ironically, we've continued to look at expansion of oncology services because we have, regardless of the financial strains that we have as an organization, we are an older community. And so cancer is a disease of an older community, and we've said that we need to create a sustainable oncology program that includes depth and breadth of services from an access perspective. And as Joe mentioned, unfortunately, through that exploration of different partnerships that might create sustainability, there was a difference of opinion that led to the departure of those 3 oncologists. But we are currently exploring partnerships that would enhance all of the service lines we view as critical for the community moving forward. There are challenging headwinds as it relates to Rhode Island. Rhode Island ranks 49th out of 50 states in the practice environment for physicians, 47th out of 50 states in its ability to retain graduates of medical education because of the macroeconomic environment that we work in. We get 20 to 30% less reimbursement than Mass or Connecticut. So that makes recruiting and retaining physicians extraordinarily difficult. And that's why when we're in the middle of that turnover, as Dr. Charpentier mentioned, I think we're doing quite well, contrary to the misinformation that's out there in terms of maintaining our turnover. And I would say beyond that, our staff turnover, our nursing turnover, all lead state averages. So this environment is one that's a thriving environment.
Does the hospital as an organization, have they addressed the opening discussions about having a medical school at the University of Rhode Island? Are you supportive of that?
We're very supportive of it. And we do think, I would say first and foremost, what we've said is the last thing we want to do as a state is invest in training physicians to leave the state. So we have to address the macroeconomic issues in the state. Otherwise, we're going to invest in training physicians that leave because they can make 20 to 30% more in the neighboring states. But we are extraordinarily supportive of continuing medical education, and we've looked into how can we participate in that. We're looking at it from a family medicine perspective as we speak, because primary care is under-resourced in this state.
And I guess my final question is, can you speak to, without getting into individual personalities perhaps, the motivation behind folks who are clearly in dissent of the conversation that's being here today?
Yeah, I would say, unfortunately, sometimes the issue isn't the issue. And first of all, Dr. O'Leary, I've never met personally. He is a concierge physician, and for those of you that don't know what that is, he left regular primary care practice to open a cash-only practice. Once upon a time, he asked us to buy his practice. We didn't do that. And Dr. Farah is a retired cardiologist who retired from Care New England. And for different reasons, I think, than what is being portrayed, they have concerns and they have some issues with the health system. But you've got 2 physicians that largely are not practicing. They're presenting themselves as if they're actively practicing. And they're misrepresenting what's going on in here. And as you heard Deb say earlier, it couldn't be further from the truth. The surveyors that were here were shocked at the difference in the treatment environment from what they've heard coming in.
Sort of piggybacking, oh, I'm sorry.
Maybe worth mentioning how many times you asked Dr. O'Leary to come in and speak.
That's a great point. I've asked Dr. O'Leary multiple times to come in and meet with me and have a constructive conversation on whatever concerns he may have. He has never responded to those requests for a constructive dialogue. Joe, as the board chair, has asked him and Dr. Farah if they would like to have a constructive conversation about their concerns. They have declined that because they want to keep it at a hyper-emotional level. They want to incite fear and anxiety based on misinformation and false assertions. They don't want to have a constructive conversation because they lose on the truth.
Sort of in that same vein, is there a reaction from some of the patients who have shared, testimonials recently in light of all of this?
May I answer that?
Yeah. He's the boss.
I haven't had the opportunity yet to hear from the patients that spoke yesterday. But I have spoken to patients or caregivers of patients from the cancer center. They're difficult conversations to have. You understand the concern, the worry, the pain, and then at the end you have to say, this is how it is. Nobody wanted this to occur. Not the oncologists, not management, not the board. But we're going to have to move forward. We have to build it back better. At the end of these conversations, they're not happy with what they hear. But they've said, I appreciate you talking to me. I feel like I've been heard. And we remain open to listening to those patients, first and foremost, and their families, of how we can help facilitate them and how we can facilitate their care and do what's best for them.
Is there any last questions? Anything? Anybody wants last comments? Well, we appreciate everybody coming out. Thank you very much. We appreciate the opportunity to ensure that the community is hearing what the accurate truth is on what's going on here at the hospital. Thank you very much.